So, welcome, esteemed students, to our lecture on anti-diabetic pharmacology. Today, we'll delve deep into the critical study of medications used to combat diabetes, a condition that affects millions worldwide. We'll explore the mechanism of action, therapeutic uses, and the nursing considerations essential for the management of this chronic disease. As future healthcare professionals, your understanding of these medications will be vital in improving patients' outcome and quality of life. So let's embark on this educational journey together and uncover the intricacies of anti-diabetic agents. So in this segment, we'll be unraveling the complexities of diabetes mellitus, a metabolic disorder that has become a global health challenge. Diabetes mellitus is characterized by chronic hyperglycemia, high blood sugar levels, stemming from issues from insulin secretion, insulin action, or both. So let's break it down. Type 1 diabetes mellitus, this form of diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the pancreatic beta cells, which produce insulin. You see, as a result, there is an absolute insulin deficiency. It is often diagnosed in childhood or adolescence, and patients require lifelong insulin therapy. You see, for this type 2 diabetes mellitus, the more prevalent form of diabetes, type 2 diabetes is primarily due to insulin resistance and a relative deficiency of insulin. It is associated with several risk factors, including obesity, a sedentary lifestyle, and genetics. Management includes lifestyle modification, oral antidiabetics, and sometimes insulin. Now for pathophysiology, in both types, the lack of effective insulin leads to elevated blood glucose levels. Over time, chronic hyperglycemia can cause significant damage to blood vessels and vital organs, leading to complications we aim to prevent. There is also gestational diabetes, but that one you see it in the note. You see that one in the note? Yes. So as we proceed, we'll explore the pharmacological intervention available to manage this condition and the critical role you play as nurse in supporting patients with diabetes. Okay, now for this slide, we're going to talk about the treatment goals. You see, as we transition to discussing the treatment goals for diabetes, it is crucial to understand that our primary objective is to maintain optimal blood glucose control. This is not just about numbers, it's about enhancing the quality of life and preventing complications for our patients. So for blood glucose control, for type 1 diabetes mellitus, our goal is to normalize blood glucose levels as much as possible. This prevents acute complications such as diabetes ketoacidosis, which can actually be life-threatening. Read about it. In the case of type 2 diabetes, we aim to achieve specific glycemic targets, typically an A1% level of less than 7%. This is vital for minimizing the risks of long-term complications such as neuropathy, nephropathy, and retinopathy. The A1% test, also known as HbA1c, or the A1C test is also known as HbA1c or glycated hemoglobin test. It measures the average level of blood glucose or sugar over the past 2 or 3 months. It is a crucial indicator used to diagnose and manage diabetes. Normally, an A1C level below 5.7% is considered normal. For pre-diabetes, an A1C level between 5.7% and 6.4% suggests pre-diabetes. indicating a higher risk of developing diabetes. Now, for diabetes, an A1C level of 6.5% or higher in two separate tests confirms diabetes. For individuals with diabetes, maintaining an A1C level below 7% is generally recommended to minimize the risk of complications. However, treatment goals may be individualized based on a variety of factors such as age, duration of diabetes, comorbid conditions, and risks of hypoglycemia. You see, it is important to note that the A1C test reflects the average blood glucose levels and is not influenced by daily fluctuations. Yes, it provides a long-term view of how well blood sugar is being managed. Regular monitoring of A1C levels help in adjusting treatment plans to achieve better glucose control. So, for the individualized approach, it is important to remember that diabetes management is not a one-size-fits-all scenario. We must consider the patient's age, comorbidities, lifestyle, and personal preferences when planning treatment. The individualized approach ensures that each patient receives the most appropriate and effective care tailored to their unique situation. By keeping these treatment goals in mind, we can actually provide a comprehensive care plan that not only addresses the physiological aspect of diabetes but also respect the individual's needs of our patients. Yes. So, as we delve into the pharmacological management of diabetes mellitus, particularly type 1 diabetes, our focus is on insulin therapy, the cornerstone of treatment for individuals who lack endogenous insulin production. So let's start with rapid acting insulin. This insulin, such as Lispro or Humalog and Aspart or Novalog, are designed to mimic the body's natural insulin response to meals. They have an onset of action within 15 to 30 minutes. They reach their peak effect in 1 to 2 hours and have a duration of approximately 3 to 5 hours. They are typically administered just before or after meals to control postprandial blood glucose spikes. Check what postprandial means. The next one is long-acting insulin. Examples include Gliadin or Lantus and Ditamir or Levemir, which provide a steady release of insulin over 24 hours. These insulin are usually administered once daily and help maintain baseline glucose levels throughout the day and night. So let's talk about the general nursing consideration for these particular drugs. Insulin is administered SC subcutaneously. It's crucial to rotate injection sites to prevent lipodystrophy. Check out what lipodystrophy means. Lipo means fat. DYS means what? Check what it means. The next one is monitor blood glucose levels. Should monitor what blood glucose levels. Monitor blood glucose level closely to adjust insulin doses as needed. And the next one is to educate patients on self-administration techniques, recognizing signs of hypoglycemia, and how to respond appropriately. You see, in summary, insulin therapy is tailored by each patient's needs, lifestyle, and eating habits. By understanding these medications, you will be better equipped to educate and support your patients in managing their diabetes effectively. So in this slide, as we continue through our journey through the management of diabetes mellitus, we now turn our attention to the oral antidiabetic agents used in the treatment of type 2 diabetes. These medications are pivotal in managing blood glucose levels and come in various classes. Yes, they come with each with its unique mechanism of action. Now, for biguanides, there are many classes, but we'll talk about this. I'll send you the notes. I'll send you the notes. So for biguanides, the primary example is metformin, which works by reducing hepatic glucose production and improving insulin sensitivity. Nursing consideration basically for this drug, general nursing consideration: monitor renal function due to the risks of lactic acidosis, and minister with meals to mitigate gastrointestinal side effects. For sulfonylureas, medications like glipizide and glyburide, they stimulate insulin release from the pancreas. Nursing consideration: be aware of the risks of hypoglycemia. Yes, very important. You should be aware of the risks of hypoglycemia. You can be taking this drug overdose, and the drug can actually lead to a secondary or reflex hypoglycemia. This should be taken 30 minutes before meals. Next one is meglitinides. An example is repaglinide, which enhances insulin secretion. Yes, insulin secretion. Nursing consideration is administer before meals. Closely monitor blood glucose levels. As healthcare professionals, it is essential to understand these medication roles, how they interact with the body, and the necessary precautions to ensure patient safety and efficacy of treatment. So let's proceed and discuss the other class. Let's discuss they are not just three. So let's discuss the remaining members of the class. Yes. So as we continue on our discussion, medications for diabetes mellitus, we focus on two more classes of oral agents used in the management of type 2 diabetes. This one is the first one is thiazolidinediones, or TZDs. Example is pioglitazone. It's a prime example of this class. Mechanism of action: basically, TZDs basically work by improving insulin action in peripheral tissues, making the body more sensitive to insulin. Nursing consideration: it's essential to monitor liver function due to the risks of hepatotoxicity. Be aware of the risks of fluid retention and heart failure, particularly in patients with pre-existing heart conditions. Yes, for DPP-4 inhibitor, DPP-4 basically means dipeptidyl peptidase 4 inhibitor. Dipeptidyl peptidase 4 inhibitor. You see it in sitagliptin is one of these drugs in this category. Mechanism of action: basically these inhibitors basically enhance the action of incretin hormones, which increases insulin secretion in response to meals and decreases glucagon production. So, nursing consideration: monitor renal function, as those adjustments may be necessary in renal impairments. Yes, patients may experience upper respiratory infections, so advise them to report any persistent symptoms. Yes, just remember that these two drugs are not, these two classes that we discussed here is not exhaustive. In fact, we've discussed five, so these five are not exhaustive. There are still more classes. If you check the notes, you see them. Yes, these medications offer different mechanism of actions to address hyperglycemia. As nurses, understanding these medications and consideration will enable you to provide comprehensive care and education to your patients with diabetes. So it's very important you read about diabetes. You understand? Yes. So, as we wrap up our session on diabetes mellitus and its pharmacological management, let's reflect on two key takeaways: holistic approach and empowering patients. Our role as nurses extend beyond medication administration. More like your role as nurses extend beyond medication administration. We are educators, advocates and partners in our patient health journey. By adopting a holistic approach, we ensure that we address not just the physical aspect of diabetes, but also the emotional, mental, and social factors that affects our patient well-being. Yes, empowerment is about equipping our patient with the knowledge and tools they need for self-management. Yes, teach patient how to self-administer insulin. Insulin is easy to administer. Teach them how to do it. Educate patients on lifestyle modification, dietary changes, and the importance of regular monitoring can transform their lives, giving them control over their conditions. Yes. In conclusion, remember that each interaction with a patient is an opportunity to make a positive impact on their health outcomes. So, carry this message forward in your practice and continue to make a difference. Yes. So, thank you for listening. It's been a pleasure discussing the complexities of diabetes mellitus and its treatment with you. Remember, the knowledge you've gained today is not just for passing exams, but for improving the lives of those you will serve. Thank you for your dedication to learning. Yes, I'll try and see how I can forward the lecture notes, but there are still more topics that we need to discuss. So I'll create more slides. Maybe after we are through with the lecture, we'll see how we can send the note over. So thank you very much. Well done.